If you run a pharmacy, here's the real truth. Most pharmacies get hit with over 300 calls every single day. And the truth is, most of those calls are not real emergencies, and they can slowly kill your pharmacy's business because 75% of those calls are completely routine. But I'm here to tell you, there's a new way using AI that actually gives you more time for personal patient care. It isn't about replacing people, it's about giving people their time back for what's important for the business. Imagine an AI phone agent that handles 70 to 80% of all your routine calls so perfectly, any time of the day, where patients actually prefer it, and while your team can stay focused on the patients right in front of them. And at VOXO, we're pioneering this technology to help our pharmacy customers grow their business and love it again. So in this video, you'll discover exactly what a pharmacy agent is, and you'll see the mind-blowing financial impact it has, and learn why this quiet revolution is spreading throughout healthcare faster than anyone expected. But first, let me show you the phone problem that's slowly killing your pharmacy's profitability. Here's a number that will shock you. The average independent community pharmacy handles 100 to 300 calls each day. A large chain location can get even more, sometimes over 500 calls on busy days. And most of these calls fall into the same 4 categories: refill requests, prescription status updates, pharmacy hours or directions, insurance or copay questions. What that means is the same questions every day over and over again. But here's what most owners never calculate. Let me paint you the real picture happening. If you were to measure it, you'd find that your pharmacists and technicians spend 3 to 4 hours each day just handling these kinds of calls. And that's not filling prescriptions, it's not counseling patients, and not running clinical services, just answering the same questions over and over again. Is my prescription ready yet? What are your hours? Are you open tomorrow? Can you refill my lisinopril? Multiply that across a month, and those calls are costing you $50,000 to $75,000 per year in hidden labor cost alone, all for conversations that could easily be automated. If that wasn't enough, here's the part that should perk you up. It's not just about time. Each phone call is an interruption. Every time that your phone rings, you're not just losing money, you're risking patient safety. So what they found was that pharmacists get interrupted dozens of times per hour, and phone calls are the #1 culprit. One Reddit pharmacist described having 3 to 5 callers on hold constantly during a 12-hour shift. Imagine trying to verify a complex prescription while juggling 5 phone calls. Now you understand why errors happen. This is where pharmacy agents become a literal lifesaver. But not in the way you think. One of our customers told me one time, he said, "When I pioneered the first robot pill counter, I knew right then I was never gonna count another pill by hand again." The first time I heard VOXO's pharmacy agent answer a call, I had the exact same feeling. I knew I was never going to answer the phone again. It's that level of a game changer. A pharmacy agent isn't the old IVR phone tree. It's not press 1 for refills or 2 for hours and location. It's a voice-based conversational AI assistant that can understand spoken language, it can respond conversationally, and take action with patients like a trained pharmacy technician would. Imagine you gave ChatGPT a voice and a phone number. That's what we're talking about. What makes it different from the old phone trees is that it's conversational. You don't just press numbers, you talk. The AI understands natural language, tone, context, inflection. It's not guessing, it's integrated with your actual pharmacy system. It knows who's calling, their prescription history, the current status of their medications, what they might need, and how to help. In other words, it's like having a digital pharmacy technician who works 24/7, never gets tired, and never puts anyone on hold. Now you're probably wondering, what can it actually handle safely, and what should always go to a human? Well, the next part will surprise you. Here's how smart pharmacy agents really are. They know exactly when to step aside and when to transfer. You know pharmacy calls fall into 2 categories, non-clinical and clinical. Here's the brilliant part. Agents handle roughly 70% of the calls because most are non-clinical routine requests. So for non-clinical calls like these, the agent handles completely. But then clinical calls like these, they're always going to go to a pharmacist. See the pattern? If it requires professional judgment, human expertise takes over immediately. The best systems use smart routing. For example, if someone says, "I'm feeling dizzy after starting this medication," well, the agent doesn't try to answer it. It immediately says, "All right, let me connect you with the pharmacist." But if the caller says, "Do you have my refill ready?" the agent handles it completely. This division of labor here is key. It protects patient safety, and it respects professional boundaries, and it keeps your pharmacy's human team focused where they add the most value. The agent becomes a frontline communicator, freeing your staff to be clinicians again, not call center agents. One pharmacy recently told me, "We've only had our pharmacy agent live for 1 day and I can already tell the pharmacy is quieter with fewer phones ringing." But wait until you see what happens to your bottom line when you implement this system. The numbers will shock you. One independent pharmacy we worked with was getting around 300 calls per day. And after installing an agent, they found that 60% of those calls were handled automatically, no human needed. That change alone freed up the equivalent of $8,000 in staff time every month, allowing their team to focus on patient care and growing the business. Here's exactly where the $8,000 in monthly savings will come from: labor recapture. Routine calls like refills and status checks no longer tie up your staff. That's 3 to 4 hours saved daily equals $2,700 a month. Missed call recovery. Calls that used to go unanswered now convert into completed refills and new transfers, potentially $1,100 a month. Workflow efficiency. Fewer interruptions means less overtime and smoother daily operations, $1,300 a month. Team well-being. Lower stress leads to fewer sick days and better retention, $700 a month. Revenue lift. Freed up time reinvested into vaccines, consultations, and MedSync programs, $800 a month. Total monthly impact is $8,600. So when you multiply that across 12 months, you're looking at nearly $100,000 a year. But the most interesting part? They didn't lay off anyone. Instead, they redeployed staff to patient consultations, vaccine services, and medication therapy management programs. So the agent didn't replace the team, it freed up the team to do more human work. And the math is beautiful. You save $8,000 on routine tasks, make more on clinical services. That is a big monthly swing. And this isn't just happening in the pharmacy world, it's been already proven across other healthcare verticals. While pharmacies were hesitating, urgent care centers and dental offices quietly started using AI receptionists. And what they discovered will completely change how you think about patient communication. Urgent care clinics use voice agents to schedule appointments, check insurance coverage, and provide test results automatically. Dental offices use agents that answer calls, confirm appointments, and even explain basic procedures or cost. In both cases, clinics report major drops in missed calls and big improvements in staff productivity. One urgent care group saw a 30% reduction in phone calls to staff, saving over $500,000 annually in operational costs. And here's what's fascinating. Patients in these settings prefer the AI for routine tasks. Why? Well, because it's faster, it's available 24/7, and they can still reach a human whenever they need to. This tells us something pretty important. Patients don't hate automation, they hate bad automation. When it works seamlessly, they embrace it. Think about it. You probably prefer ATMs for simple banking, but want a human for complex financial advice. Same principle applies to pharmacy communication. These examples show that this isn't a futuristic idea. It's a working model across healthcare today. Pharmacies have just been a little bit slower to adopt it. But that also means there's an opportunity for early adopters to stand out by offering 24/7 service without the extra payroll and faster response times that patients really notice. So if the patients accept it and the savings are real, how do you actually implement this without disrupting your workflow? Here's the step-by-step process. Rolling out an agent isn't flipping a switch. It's like training a new employee, but with a proven 7-step process. Now I'm going to walk you through this like you're a new customer here at VOXO. Step 1. We're going to install your phone system. We're going to make sure there's no downtime between your old system and your new system. Step 2, we're going to connect your pharmacy software. This lets your agent see real-time info like prescription and refills without ever sharing sensitive data. Step 3, give your agent a name. Pick a name for your agent. It helps your team and your patients feel like they're actually talking to a team member who's part of your pharmacy. Step 4, add helpful information. Teach your agent what it needs to know, your hours, location, your refill rules, and answers to common questions. And step 5, make it sound like you. You can choose your agent's voice, male, female, long list of voices to pick from, and choose a greeting that fits your pharmacy. You can set rules for when your agent should send a call to a real person. Step 6, tell your patients about it. Let your patients know what's new so when they experience it, they won't be shocked. And last but not least, monitor how it's doing. Use our dashboard to see how your agent is performing. You can track calls, you can see what's working well, you can make changes anytime. The goal here is you're not shocking your patients or your staff, you're easing them into the system. The most successful pharmacies start with simple tasks, then expand as everyone gets comfortable. And within 30 days, everybody gets used to the system and you start realizing ROI. And don't worry, you won't have to do this yourself because a team like ours at VOXO, we're here to take care of you 24/7. That said, this is just the beginning. The future of pharmacy communication is about to get even more exciting. So we know pharmacy has always been about accessibility. Patients trust you because you're easy to reach, you're there for them. But as call volume and workloads increase, that accessibility is at risk. Pharmacy agents are becoming the new front door to your pharmacy. They don't replace the relationship, they protect it by ensuring every call is answered, every request is fulfilled, and every patient feels heard. Over time, this technology will likely expand into outbound communication too. Automatic refill reminders, pickup alerts, vaccine scheduling, and even delivery updates. Think about it this way. Just as e-prescribing and digital records became normal in the 2000s, AI communication will be the standard by 2030. Pharmacies that adopt early will have smoother operations, lower cost, happier staff, and the competitive advantage. All right, so today you discovered how agents will save pharmacies $8,000 monthly while improving patient care and staff satisfaction. But here's what I didn't tell you. The same technology can actually grow your revenue by 40% or more. Most pharmacy owners never discover this profit multiplier because they stop at just the cost savings. In a future video, I'll reveal the outbound agent strategies that turn your phone system into a revenue-generating machine. You'll see how pharmacy agents are adding up to $15,000 monthly to pharmacies' bottom lines through proactive patient engagement. That's it for me. I'm Brennen from VOXO. Thanks for investing your time and learning how to build a smarter and more profitable pharmacy. Subscribe if this was valuable, and I'll see you in the next video.